In conclusion, cannabis is used as a holistic approach to medicinal therapies. The nurse plays a pivotal role in implementing cannabis as a medicinal treatment. Through patient education, there is a need for nurses to step up and educate on the potential risks of and benefits of cannabinoid therapy, such as administration, different side effects, and dosage, timing, precautions to ensure safe use. The thing about cannabis, it is super, super, super addictive in some cases, and patients can be dependent on it. So knowing the right education to give a patient in order to know how to use it is very important. Assessment and monitoring. Nurses can assess patients before initiating this therapy to identify any contraindication or potential drug interactions. Throughout this treatment, the nurse needs to monitor adverse reactions, changes in symptoms, and signs of misuse or dependence, like I had brought up. There are several advantages of using cannabinoid in mitigating symptoms in MS, but providing that proper education in use is super important. Collaboration with healthcare is also super important. Nurses collaborate with each other and other healthcare members, including physicians, pharmacists, and other healthcare providers, to ensure coordinated care is happening. So, for the use of cannabinoid, they need to communicate patient progress, share relevant patient information, and contribute to the interdisciplinary care plan to optimize those patient outcomes, especially those with MS. Promotion of safe practice. I cannot stress this enough. Nurses can promote safe practices for the use of medicinal cannabis, including adherence to legal and regulatory requirements, as the regulations do differ in state. Requirement of proper storage, disposal of cannabis products, and avoidance behaviors that may increase the risk of harm, such as driving under the influence, going to work, things like that. They can advocate for policies, guidelines that support safe and responsible cannabis use. And support for symptom management. Nurses provide holistic care to all patients, but in regards to MS, addressing not only physical symptoms, but the emotional, social, and psychological needs also being addressed. They can offer support, resources for symptom management strategies beyond just cannabinoid therapy, and using cannabis therapy as an additional complementary treatment on top of any other medicinal, as long as there's no drug-to-drug interaction. But this would also include lifestyle modifications, physical therapy, and psychosocial interventions. And then continuing education on the nurse's behalf. As cannabis makes its way into medicine, there's ongoing research, ongoing evidence-based practices, ongoing treatment. In order to stay up to date, there needs to be continuing education and research being done constantly. This does play a pivotal role, so the nurse is up to date on latest laws, latest symptom treatments regarding cannabis therapy. There are several barriers, the biggest one being social stigmatization. Cannabis is classified as a Schedule I controlled substance in many countries, including the United States, which makes research and medical use extremely difficult due to the strict regulatory controls. Even in places where it's legal, medicinal treatments are usually only implemented, whereas recreation use is still illegal. So the cultivation around that, there is a separation barrier, still causing a bit of gray area regarding that. My recommendation is more education on cannabis use in medicine and having that research saying that it does help with effects of MS and other chronic conditions. Helping destigmatize and use it as just a medicinal therapy is important. And make sure that we're doing mental health screenings and other screenings before administering cannabis as a medicinal treatment to avoid misuse, to avoid dependence on it.